are our different types of central lines, and that includes PICC lines as well. It also includes your dialysis catheters, which are the ones that we do not remove.
No touchy.
No touchy. We do want to monitor those, of course, though, just like we're going to monitor the others for anything that's underneath that dressing, if there's any kind of oozing or anything, because we want to be sure that we don't have any kind of infection going on. In order to start a central line, it has to be a physician order. We know that. And these are some of the tools we use. This is our kit, and this is a good example of a PICC line. I know. I could put him on like this. I know. When they're placed, you're going to, when the central line is placed, you have the bile patch, which is here, that you're going to place around the catheter. Now, it doesn't say how you have to place this, whether you put the slit down to the side, which way. Quite honestly, when you're having to take this off, if you will put the slit upwards towards it, there's less pulling and tugging.
Yeah, for sure.
So it just makes it simpler. But that's your choice. After we do that, then we're going to put over what we call the shirt, okay? Which is this, to secure that, okay? Then we're going to put on what we call the pants, which is this part right here.
Yep.
Then my pants went to. It's going to be something like this because it also has the holder. I can't think of what you call it right now.
I know what it is.
Yeah, but it's going to go underneath it so it maintains these to be secure, so it's not moving. Now, it's been recommended that when the physician starts this line, used to they always sutured them in. Yep. It was just like a suture here, a suture there, whatever. It's been recommended not, but there's still some physicians who are going to do that. And our adapters that we use here to secure them helps to secure that better. So it makes it easier for them not to have to suture it. After you have placed the shirt and the pants, then you're going to place the belt, and this is where you're going to put your name and the day it was started or whatever. And I believe it's every Tuesday, okay. Then these have to be changed out.
Doing those last night.
Also, you're going to make sure that they have the caps on and then the Kuros cap. Most places use just the Kuro caps, and I know that they do here. However, there's a facility that I know of that doesn't. They use a different color for the blood.
Oh, okay.
Typically, most places just use this for blood because it's red, and it makes it easier. Because you don't want to draw blood from one that you're placing like antibiotics through or whatever. When you get ready to draw blood, you're going to pull out 10 cc's, you're going to waste it, and then you're going to pull out 10 more cc's. And after that, then you're going to flush it with 10 cc's of saline. Okay? If you happen not to have a Kuros cap on it for some reason, be sure you scrub the hub because we don't want any infections whatsoever.
Oh yeah.
Yeah, that's really, really important. Yeah, it says right here, Tuesday change. But you also change it, if, like I said, if the dressings are messy or there's some leakage or whatever. First of all, if there's leakage or whatever, you're going to find out. You want to call the doctor and find out. But you also want to change that later because we don't want an infection. Also, we do CH fast daily, to help cut down infection as well. Over here we're talking a little bit more about PICCs, which is another type of central line. Um, this is a picture of a pig, and this is a picture of a double. I've personally never seen a double. I've always just seen the single.
Yeah.
This one has like a silicone plastic type insert that the needle goes into, but they also have the ones with cork, and you can tell the difference whenever you. I know I put that in there because it just has that feeling like
Different feel.
your nails, yeah. But these are placed by surgeon, of course. You know, typically it's left side. I have seen on the right, but very few. This on the left side, and they'll have a little incision there. That'll be all. Some people, after they use them for chemo, will continue to keep them, especially your older population, because they have such fragile veins. And at some point in time, and at some point in time, it will keep them from being stuck several times if they're back in the hospital for something. So when you're doing your initial assessment, you should see that. You know, whenever you're checking skin or whatever, most of the time the patient will tell you. Just like if they have a port, sometimes the patient can tell you what size needle to use. You know, I mean, they're all up on it because it's been there for a while and they're comfortable with it. It's kind of like a diabetic telling you how much insulin that they need or don't need. You know, you need to listen to your patient.
Exactly.
Of course, you can access the Reliable Hair Blueprint on RCD, the Texas Health website. This shows you what the Metaport dressing looks like. This is a little bit different, but it's similar to this, but it's okay. She went to look for one, but I don't have one that's just like that. I do, however, have the needles. So over here. Oh, one of the things I forgot to tell you. On the central line, you want to be sure that it's sterile technique, whatever.
Oh yeah.
So when this is open, this is what came, because that one was closed. So you want to make sure that you have a mask on, which, and the other patient has a mask on, and that they're facing away from you. You'll have your sterile gloves. This to start your cleaning with, and when you do this, you know, you start at the middle and you work your way out, because we don't want to work our way in and push in something that we don't need.
I love these kits.
Oh, I do too. These kits are great.
It's amazing.
Yeah, they come a long way too.
Yeah.
Okay, and I'm going to get Judy to show you. She has a port, so we actually have someone here. To fill your port, you're going to mash around and just feel, and then you're going to put it between your two fingers, and then that's when you're going to access your port right in the center.
Yeah, those butterflies come up, yeah. Right, don't they?
No, you don't push those down until you're finished because it closes it.
Oh, I thought they kind of came up.
Yeah, but not until you're finished.
Oh, okay. Alright. Where are we? It's kind of awkward to hold. Oh.
And this feels a little bit different, of course, than a human. It always does.
Okay.
When you feel Judy's here in a minute, you'll be able to tell. I mean, you know, our flesh feels a little bit different than this
This
plastic.
is a little thick.
Yeah, it is. It is.
Okay.
So when you're de-accessing, of course, you want to pull. You want to hold that down.
Yeah.
And then pull back, because it's harder to de-access than it is to access.
Okay.
Okay? And then you can close that. And it closes the needle.
Okay.
When you de-access it also, be sure that you clean it real well, okay? And then they should not have any major bleeding from the side. You should be able to use a Band-Aid or 4x4s and tape. If there's a massive amount of bleeding or a lot of bleeding or whatever, something's definitely wrong with the port. But it should be something just as simple as a Band-Aid after you hold pressure. And from the time that you de-access to the time they leave, it will give you time, you know, to see if it's going to bleed. Because remember, a lot of older people have anticoagulants. One thing I forgot to tell you is to be sure that you heparinize this port. Okay? You're going to run saline. You're going to put 10 cc's of saline, and then you're going to put 10 cc's of heparin before you do access. Okay? I don't know if y'all have any people that come back in day surgery or outpatient or whatever for flushing on these. If they do, it's going to be the same thing. 10 cc's of normal saline and then your 10 cc's of heparin.
And when you first access it, don't you draw back and remove everything, or do you just go ahead and flush that through? I don't remember.
You're going to draw back. You're going to see whenever you access it, you should see blood return. Okay, and you can draw back to make sure. Okay, just like you're going to do on a peripheral. Okay. It's a little bit different with the IVs that we have now because of the way that the blood stops or whatever. But we can still draw back.
Yeah.
Because you want to make sure that it's in there.
Yeah.
Okay. Do you have any questions?
That was it.
Okay. Well, if you have any questions or think of any, let me know.